Good day, everyone. My name is Marceline Derry,
And I'm Daily Leach.
and together we chose the topic HIV and AIDS and sexually transmitted disease in our Latino community. I'm talking about Hispanic people based in the United States of America. And we chose this topic because we we want to understand why they are so much at risk in contracting the HIV virus and other sexually transmitted diseases.
And yes, throughout our PowerPoint, our end goal is to make you guys understand why their culture is that way. It is a reason behind it, and we want you guys to understand. And hopefully, throughout this, you will pick up on that and hope we can get through this epidemic and help the Hispanic community.
And what other way to start rather than tracing back into history and getting to know these people for who they are and respect them for who they are and what they represent. Talking about the history of the Hispanic Latino people in the United States of America, Latinos are a culturally and genetically diverse group. Today's Latino population represent a blend of a common gene pool from Central America, numerous and varied adaptations, further mixes with a large number of migrants from other nations. They are not a newly arrived group of people in the United States of America, although many have indeed migrated in recent decades. Talking about descendants of five waves of migrants into the United States of America, mixed with groups of people from Africa and other European nations, making it one of the most racially and genetically diverse population in the world. 47% of Latinos are foreign born and 32% are naturalized U.S. citizens, and 63% are Mexicans, 9% are Puerto Ricans, and 3% are Cubans, not living out those from that is Salvadoran and those from with Dominican Republic origin. And throwing more light on education and employment, there are diversity or disparity in education and attainment. High school diploma or higher account for 61% of Hispanic and or Latinos. 12% receive bachelor's degree. But in terms of employment, it was rather interesting going through different sources to find out the Latinos that do constitute the backbone of the American agricultural sector. Yet we have a large number of them living below like a good standard, living like in high poverty rate, and this is what bridges or widens the gap for them to that's go in for good health or need. And talk besides our main topic, we equally kind of like discover that besides HIV plaguing this subset of the American population, they are also prone or at risk in contracting, being sick with asthma, diabetes, mental issues, tuberculosis, just to name these few. And on that note, we have a first question. And this one was like a little puzzle for me because before working on this, I knew all Latinos were Mexicans. It sounds very funny, but it's never too late to learn. And Latinos Americans are of Mexican, Cuban, Puerto Rican, and Hawaiian descent. True or false?
Now we're going to talk about the side to the epidemic that we know as HIV, AIDS, and STIs in the Hispanic community. Latino Hispanics made up 17% of the U.S. population in 2011, but they accounted for 21% of the HIV infection that was diagnosed. And in the male population of the Hispanics, they estimated at 79% of the infections from male to male contact. And that's a staggering number because that means that male to male contact, these men were living on the DL, as we call it, and then going home to their wives and sleeping with their wives and giving them the same infection. Only 11% were heterosexual that was diagnosed, and 8% came from IV drug use. The females in 2011, they accounted for 86% of the HIV infections that came from heterosexual contact, and none for homosexual contact that was noted. 14% came from drug usage. In 2010, gonorrhea is high among Hispanics as well at 49.9% of the cases per 100,000 of the population. And this is 2.2 times that of whites. Chlamydia was at 369.6 of the cases, and this was 3 times the rate of whites. And for syphilis, it increased 9.5% from 4.2 of the cases to 4.6 of the cases. And here we have a video for you guys to watch. This video is gonna give roundabout way. The doctor here, she goes into great detail about how we're gonna go and prevent the STIs and how we're gonna help our community in doing so. So
1 out of
here we
2
go.
sexually active individuals will contract a genital infection during their lives. For this reason, a smart, preventative approach to sex is vital. Sexually transmitted diseases, or STDs, are consequences of many sexual encounters. The only way to ensure that you don't contract an STD is abstinence, but for many people, cutting out sex is not an option they choose. For this reason, some people have sex monogamously with only one partner who may or may not be STD-free. Be honest with your partner about your sexual history and ask that he or she is honest with you. If you do take on a new sexual partner, talk to a doctor about getting tested for STDs before you have sex. You should do this with every new partner, or if you suspect a regular partner is engaging in sex outside of your relationship. You can further reduce your risk of contracting an STD by keeping your partner's bodily fluids out of your body and asking your partner to do the same. The male latex condom or the female condom can provide some protection during sexual activity. When used correctly, both male and female condoms can reduce the transmission of HIV, gonorrhea, syphilis, chlamydia, and trichomoniasis. They can also offer limited protection against other STDs like HPV and herpes. In general, condoms are more effective at protecting against diseases transmitted through bodily secretions like HIV than those transmitted by skin-to-skin contact like HPV. But it is important to keep in mind that wearing a condom is like wearing a raincoat on a rainy day. You can still get wet. For a condom to be effective, it must be put on correctly before any sexual contact is made. Unwrap the package and hold the condom up to the light. Make sure that there are no rips or tears in the latex. Then unroll the condom over the erect penis to the penis's base. Leave about ½ an inch of space in the tip of the condom for semen. Immediately after ejaculation, hold the condom's rim at the base of the penis and exit your partner. While the female condom is not as effective as the male condom at preventing STDs, it can be used in people who are allergic to latex. The female condom looks like a tube with 2 rings. Insert the inner ring into the vagina as far as it can go, leaving the outer ring outside. After sex, remove the condom before standing up by gently pulling it out of the vagina. Talk to your doctor and your partner about getting tested for STDs and about ways to protect yourselves.
Want to learn more? Check out other videos and sources on this site for more information.
In that video, as you can see, it brought a lot of good points about, especially about monogamy, and that we should, if you don't think that your partner is being monogamous, you should protect yourself. That will stop the transmission of these infections and HIV, of course. Now, question number 2 is, will condoms protect against chlamydia, gonorrhea, or HIV? Is this true or false? Now, in the Hispanic community, some don't seek treatment because of certain barriers. And, they need this disease prevention and this health promotion to protect them against these diseases and other diseases that we talked about earlier, like the diabetes, the asthma, the TB, things like that. In the community, these barriers are significant because they are the fastest growing population in the U.S. There are significant differences in perception of disease casualty as well as the treatment that must be understood and worked with if health promoting efforts are to be effective. Religious beliefs, such as being more trusting of individuals, the practitioners. They rather have a practitioner than use the hospital system. They view human touch as respect and would expect a handshake and a formal use of their last name upon introduction. Support is found in their church, their family, friends, in the community, in their community. They're close knit and they don't seek kindly to outsiders. You have to be a part of that family or earn that trust from them. Some prefer to use both practitioners. They're called the curandero and the curandera. You know, we've learned that before. They are present time oriented as well. The past is over and the future is uncertain. So the now is what they feel that is important. Overcoming these barriers, we see, of course, we have to have that cultural competency and that sensitivity. You can't be insensitive to these individuals. We have to embrace them. They are the fastest growing population in the U.S. and having those bilingual people around to interpret for them, making that extra effort to put it in Spanish if they don't understand that information. Sometimes in their culture, they don't know that in the Western culture that we do preventative measures. We don't wait till the last minute to say, oh, you have STI, we need to fix that. Prevent it first, then you won't have to worry about seeking that treatment. Like I said before, understanding them, their orientation, that will be it.
Okay, and on that note, we do apologize in the case of you listening or watching because
It's 3 o'clock.
we're going through some technical issues. In the course of this assignment, we've learned how to manipulate the laptop and come up with things that we didn't even believe we could do it. So in the course of it, if there's any technical mess up, we apologize for that. And based on that question number 3, it rates what are barriers in Hispanic community in seeking health issues? Is select or that apply. Most nursing students don't like questions like this, including myself. Time orientation, access to care, religious beliefs, communication patterns, cultural insensitivity. And question number 4, what are Hispanic at greatest risk for contracting? Pneumonia, celiac disease, HIV and AIDS, HPV. And this upcoming video is actually a public service announcement as nursing students or future nurses calling upon other people serving in the world of nursing. It is our place, it is our responsibility to educate our youth when it comes to sex education. And the video actually throws more light that parents are the key. Prevention is better than cure sometimes. And here is the video.
Nearly half of Hispanic high school students are sexually active. This could be your daughter. 41% of them don't use a condom. This could be your son. Any of them could have HIV or other STDs. Parents, please help them prevent
chlamydia,
syphilis,
Gonorrhea.
herpes,
genital warts,
And HIV/AIDS.
Parents, use the power of your love to protect your children.
So from the video, we see that it's actually calling on us to be as forerunners when it comes to health issues, educating the Latino people, not just the Latino people, patients will come to the hospital when it comes to protecting themselves. And to continue with our presentation, I'll be talking more on the Hispanic and Latino adolescents and teens, why they are more prone in contracting the HIV virus and other sexually transmitted diseases. Hispanic adolescents and teens are engaging in risky sexual behaviors and increasing their vulnerability to contracting STIs and HIV, the HIV virus, for basically different factors because of lack of education. And sometimes this is kind of like this kind of channels to cultural barriers. Most of the parents, some parents, I wouldn't say all Hispanic parents, some parents are sometimes like unapproachable and they will scold and they will not entertain sex education. And research has found that parent-child communication is positively related to consistent condom use, sexual knowledge, and sexual activities. Uh, Actually related, and this is really healthy. Education is key when helping the adolescent and teen, increasing the attitude, knowledge, and perception of abstinence and the use of condom.
So, after talking about all of that, what did we do together as students to inform and help the Hispanic community? Well, we began with a questionnaire. Um, we talked with some individuals in the Hispanic community. We had a pamphlet, a Facebook page. We educated about STIs and HIV, preventative methods. Our dilemma, though, was figuring out how we were going to get the information to the Hispanic community since they're not so trusting and accepting as to outsiders. We were both considered outsiders in the community, of course, and trying to get in was difficult, but we tried to find some friends to help us through, and we pushed forward and we got all our information that we wanted out there. Naturally, social media came to mind, so we started our Facebook page. We got that out. We did a questionnaire. We did one in Hispanic and English. So once we got to the community, if we didn't have ones that spoke English, they could look at it and, oh yes, like, and that's a shocker for some people because they don't expect you to do that, to go that extra mile. And I think that helped us get a lot more questionnaires back and doing it that way. Our pamphlet covered HIV/AIDS because that was the one thing that affected the community the most. STIs do as well, but the HIV really, it's hitting home in areas, and I don't think they realize how bad it's affecting them. And lastly, going into the physical community, yes, most individuals walked away, but they opened up to us once we started talking to them and getting them to understand this was for school and understanding that situation. One life saved is better than no life saved at all. So we feel like we got our point across.
Okay, and based on the HIV pamphlet, like she earlier said, we created a page, a Facebook page, because the media world today it's like leaving your kitchen and walking to your bedroom. So the Facebook was just like that channel for us to get to so many people and get different opinion on the topic. And a pamphlet, we had that distributed. Yeah, in Tulsa we have a Latino shopping center. It's called Morelos. So we kind of like got there and had a one-on-one with some of the Hispanic who come to shop there. And it was quite challenging, based on the fact that we as nurses, we have to stay culturally sensitive because HIV is still kind of a stigma in our society today. But we kind of like pulled that through. And our pamphlet did cover some questions like, how do people get the HIV? Is confidentiality still respected when you come, like you want to go to a hospital and run an HIV test or any other STD test? And basically that's it, and how I can protect yourself, how to use a condom and things like that. And so basically that was, and the purpose of the pamphlet was just to bring more awareness to the Hispanic community and provide community referrers in case they need help and someone to talk to.
In our Facebook page, if you guys haven't liked it, if you don't want to like, you don't have to. Just go by and look at it. It has a lot of inspirational quotes. I tried really hard with the help of Barry to make sure that we got the meat and potatoes of this is what you need to do, this is how this works. We put videos up and inspirational quotes, and I remember one vaguely. It was about HIV, and it said something about, oh, I have HIV. How do I have HIV? I feel normal. I'm not sick. And in people's mind, they really believe that because you're not physically ill, you don't look like you're smoking some bad stuff and sick, that, oh, I don't have HIV. Yes, you do. The tests prove it and the results prove it. So I just felt that doing this would help bring awareness to the community. So Barry and I want y'all to go check it out. Just breeze through it and see what you think.
And we came up, besides the Facebook and the pamphlet, one of our intervention was to come out with a questionnaire. because we're talking about a people from a different cultural background, meaning their language is different. And to break down that language barrier, the communication, which some of the Latinos that we did talk to, or we had a conversation with, they said one of the reasons that is stopping them to that's going to the hospital because of the language barrier. So our pamphlet, though we came up with the English pamphlet because they are definitely the educated. Some of them do read English, but a bulk of them they did prefer the Spanish, the questionnaires in Spanish. And the purpose of this was to make a Spanish questionnaire to be culturally sensitive. How would they answer the questionnaires if they could not read or speak English? Some individuals did like the Spanish questionnaire, so it was really helpful.
And how did we go about reading the results of this? We broke it down like male, female, single, married. We passed out 56 of them. We wanted a variety, and I think we did. We had 21 Hispanics. 11 were female, 11 were male, 10 were female. 15 were single and 6 were married. We had 13 African Americans, 7 were male, 6 were female, 4 were married, and 9 were single. We had 12 Caucasians, 4 male, 8 female, 5 married, and 7 single. We had 4 Native Americans, 1 male, 3 females, 1 married, and 3 single. We had 5 Asians, 1 male, 4 female, 1 married, and 4 single. And we had 1 Pacific Islander, a single male. And as we continue with it, we broke it down to those that were monogamous, those that used protection, those that would seek treatment, and those that were fairly knowledgeable about what STIs were and if they caused infection. And as you can see, for the most part, the individuals were mostly all in monogamous relationships, so they said in the questionnaire. And sometimes with questionnaires, people put what they think you should know, but I was hoping they would just be as honest as they could when we're out there hitting the pavement trying to get this information. So for the most part, like I said they were monogamous, but when they were monogamous, they weren't using protection. And I didn't quite understand how they weren't, but they did not. And in the Latino religion, going back to what I was saying, how we would better understand in their community, it's this cultural thing called Moreno Manazomo. I think I butchered it, but it's Marianismo. It's when the woman is supposed to be married. Culturally, she's supposed to be a virgin upon marriage, and she leaves all the decisions to the male. So if the male says, I'm not using a condom, guess what? He's not using a condom. And he could be that one sleeping with the male, back behind closed doors, or another female even, and then give his wife whatever diseases he had, she now contracts. And that's a lot of personal belief as well. So if they don't believe, they won't use them, or they sometimes will. And that was a surprise for us, I promise, it really was. But for the most part, they all knew what STD, HIV, they knew what that was. But monogamy does not always hold true. So be open and honest with your partners, and we're stressing that they have to be honest. And if they're not honest, this is what brings this epidemic of the HIV, AIDS, and STIs in their community. So we have to be smart, take care of our bodies, and stop the spread. Now, last question. Now, in your own words, explain why some Latinos choose not to use protection in a monogamous relationship during sexual activities.
Okay, and we have a video to play.
Hi, I'm Erica. I consider myself Latino. I was born in Tulsa, Oklahoma, but my entire family is from Guatemala. Healthcare. Now, with Hispanics in healthcare, during my experience, what I found is that it's difficult because there's that language barrier. Throughout childhood, I had to translate for my parents, even as a little kid. And it's hard because sometimes they never provided interpreters, and I don't know the medical terminology. So, like for example, recently, I went with my father for a doctor's visit, and I just didn't know some of the words that the doctor was telling me, so I had to Google it, look it up. But I imagine if I wasn't there, sometimes he'll come back, he's like, I didn't know what the doctor said at all. And he'll just go because it's something really, really important, really drastic. So throughout my entire life, you only go when there's something super horrible that's happening. Because if it's a common cold or anything, you're gonna drink jarabe. Jarabe is like a drink which is like lemon, honey, and hot water or soda, Pepsi. They'll boil Pepsi and put spices, ginger, and that you're good. That for them is all fine. So that's the only way you'll get rid of a cold. You don't need to go to the doctor. And then money is a tough thing because my parents, they came over here trying to look for a better life. My mother is a cafeteria worker. My dad worked as a technician for industrial air conditioning. And his problem was, I'm here to work, save money. Going to doctor is costly. And then they didn't have like insurance. It was just one of those crazy things like finding insurance. And then another problem is knowledge and education about diseases. So we just know something's wrong. Is it bad? If it's too bad, then yeah, I'll go to the doctor, see what happens. They'll just give me medicine and I'm on my way. Like, taking care of your health isn't something majorly, or like nutrition. I'm just gonna go buy food somewhere. It's a lot of education and knowledge is not there. So education, knowledge, money, medical interpreters. Let me think. What else? That pretty much sums it. But it's just like healthcare in general. It's kind of a thing pushed off to the side. Let me work. Let me get stuff done, and then I'll see if something's wrong. I'll go if I have to. That's pretty much the idea, the knowledge.
So I understand as part of your culture being a Hispanic, certain topics are kind of considered as a taboo. You don't talk about it because that's how you were raised.
Yeah. Like earlier, I was talking with you about the HIV and sex thing. It's something you don't really talk about with parents or family. You find it out all on your own. So, like that, like you'd find it out, I don't know, if you do go to the doctor or you do go somewhere like that, but you just don't talk about it with your family. You find it all on your own. You go through school, you end up with somebody, or if you go to the doctor and the doctor does mention it, you're like, okay, what is this? Can you explain or something? But honestly, it's just something you don't talk with your parents. I've noticed it with a lot of other Hispanic families, either be families from Mexico or from Honduras or Salvador, that it's like a common thing. So like throughout high school, I hung out with just a group of a whole bunch of like Hispanic students because I was learning Spanish and English at the exact same time. So as I was learning Spanish, I found out that like, oh my gosh, none of us, it was just a topic that like none of us know. We're just gonna explore the idea. I feel like that's a big thing too. And Hispanic culture is some part of the Hispanic culture is like getting together, family. Everybody knows that family. Like it's a common thing. They say, oh, Hispanic culture. They have that big reference on family. Thing is, there's that love and family togetherness. We just don't know anything about the medical aspect. We're just going with it. And like we'll hang out with people, we'll go party. Like there's some club that's like in Tulsa is called Imperio. People just go for fun and stuff. But it's like they don't think about the risks or anything about if they do go with somebody or something like that. And I feel like that's just a big downside to Spanish culture.
Thank you.
You're welcome.
And on that note, from the interview, you can see that this young lady, she kind of like sum up everything that I'm talking about that Hispanic people are facing. And before we wrap up our presentation, it's important that as future nurses or as student nurses, we try to stay culturally sensitive. We try to stay non-judgmental. The stereotyping perception should be swept away. And talking about ethnocentrism, we don't have to promote that when we in the health field. And it is just our place to educate these people, and I want to call on the media world to play a vital role, because the world today is becoming a global village, and the television and TV shows play a role in the lives of the young ones. That's going to be just one of the recommendation that together we will call in maybe on future writers or researchers to want to throw more light on.
Yes, and to add what Barry was saying, we do, as you guys listened to our PowerPoint and heard the views of that young lady, that side of it, that aspect of it is the problem with the Hispanic culture. It's not that it's wrong, it's that they have to be educated more about why they should use protection. This is harming them, their bodies, their culture as a whole. They have to be educated no matter what. I mean, they may have one viewpoint from somewhere else, but it starts at home. The family should be teaching these children at home. Even the school should play a part in that, because I feel that they're not given the justice they deserve. If they can't read English, give it to them in Spanish. They need to know it. If they don't know it, they won't know it. That's how that goes. But we hope we shed a light for you guys and opened your eyes to this culture and how this process goes. And see you on the reverse side.
Thank you.
Thank you.